My name is Frédéric Destrebec. I'm the Executive Director of the European Brain Council, one of the many partners of the CSA BrainHealth. And it's our pleasure of organizing this webinar today. Webinar on the topic of the Global Brain Research Agenda, which is now the second in our work as work package leader for global outreach and collaboration. So I will be moderating today's webinar and moderating in particular the conversation. But I would like to introduce our first speaker and CSA BrainHealth coordinator, Dr. Ulrike Bushoff, who is speaking on behalf of the German Aerospace Center, the DLR, and on behalf of the coordination of the CSA BrainHealth. So you've seen all the housekeeping rules. We ask you to stick to that in terms of silence and the quality of our conversation. So please turn off your video and your microphone and use the chat for any interaction. We'll also record the webinar and all the presentations for the reporting purpose. And on that note, Ulrike, the floor is yours.
Thank you, Frederic. So it's my great pleasure to welcome you here today to this virtual webinar for global stakeholders. I'm the coordinator of the Coordination Support Action for Brain Health. I'm with Project Management Agency of DLR. So we are supporting the German government in the implementation of its health research program and also in its international cooperation efforts. And among others, that's why we are coordinating this CSA. And we are partnering in this EU-funded project with national European research funding organizations and ministries, patient representatives, and the European Brain Council. So thank you to our colleagues at EBC for organizing this important event. So just a question, can you hear me well? Because there are some chats problems.
Well, we were about to answer to that. I mean, we can hear you okay. It seems that Cecilia Garek has an issue.
Good.
But yeah, others seems to say everything is fine. So Cecilia, maybe we'll ask you to recheck your audio because there is no particular issue on our side.
Good, then I just proceed. Thank you for the feedback. So currently, more than 50 partners from over 30 countries within and beyond Europe are working really, really hard to get this partnership for brain health off the ground. And we are making great steps towards its launch in January 26th. So just a few days ago, we handed in the proposal of how it's being designed to the European Commission. The aim of the future partnership is to find answers to the major medical, technological, and societal challenges posed by mental and neurological disorders in Europe and worldwide. So it's likely to be the biggest initiative in brain health research in the next decade, trying to align investments and reducing fragmentation in EU and worldwide. But to generate this maximum impact on improving the quality of life for those affected, we are now building a wide-ranging and really diverse brain health ecosystem around the core of the partnership. And for this, obviously, involving the stakeholders is absolutely crucial. In particular, the European Partnership for Brain Health reaches out to relevant global organizations, initiatives in order to further strengthen and expand international collaboration and global outreach. And this includes the involvement of national funders beyond Europe, such as New Zealand, Canada, and Israel, which are already on board, as well as close links to the scientific communities within and outside Europe and to global organizations in the field. And the overall aim is to put brain research on the global stage to boost its international visibility together with like-minded partners and to foster global knowledge exchange. And in this respect, obviously, today's webinar for global stakeholders is an important puzzle piece on our way to a holistic brain health ecosystem. So that's why I don't want to keep you any longer and wish you a successful event and looking eager to see the discussions here. Thank you.
Thank you very much, Ulrike. And obviously, on the basis of what you just said, I think it's important that we emphasize that today we had the pleasure of inviting experts and representatives of international organizations, each having a stake or each having or undergoing activities in the brain space, so to say, sometimes really specific to mental health or sometimes, let's say, more general and more with a societal objective. And obviously, what we would like to generate with today's webinar is first capacity to hear a report back from all these initiatives and learn a little bit more of what is going on the side of these actors. But then that afterwards at 12 we start a conversation and an open dialogue to maybe nurture the reflection and animate a discussion to seek what would be, let's say, the avenues or the opportunities for collaboration and further discussion. So our first speaker in that respect is coming from the OECD, the Organization for Economic Cooperation and Development, and this is Francisca Lopez. So Francisca, we invited you to speak about the evidence base for more action on brain health. So we are eager to hear from you what OECD is busy with in that respect. So over to you, Francisca.
Thank you so much, Frederic, and thank you to the CSA BrainHealth for inviting the OECD to discuss a bit the topic. Over the next 10 minutes, I'll bring you a mix of some evidence and data we've been collecting on trends and prevalence, but also the consequences of impacts on brain health. You'll see that I'll be covering mental disorders, mental health, but also a bit of dementia. So the different domains that we work on within the concept of brain health. And I'll start with some trends on actually mental ill health, because we know that, oh, sorry, let me see for some reason. Yeah, here it is. So this was just my introductory slide. And let's then start with some figures. We've, of course, been monitoring mental ill health for a long time, but I want to bring you this figure that tries to look a bit at before and after the pandemic, COVID-19. We here have some depression and anxiety symptoms in countries in which we could retrieve data for that. And the big message is that we definitely saw an increase in, like, say, psychological distress and these symptoms of these conditions during the pandemic. And then more recently, the more recent data we have here is 2022. We were seeing like a decrease in those, but still much higher than pre-COVID. So mental health is not really fully recovered, or at least in 2022 we hadn't since the pandemic. And furthermore, we also know that mental ill health is very unequally distributed, which is very relevant. The graphs are complex. I don't want you to apprehend whole, but I wanted to highlight here, again, this is about moderate and severe symptoms of depression. The top graph is by sex, and you see that, in what concerns these symptoms of depression, female have always a much higher prevalence in all the countries studied here, all the OECD countries. And in the bottom, we have a figure by income. And again, you see that people in the lowest income group of the society in each country also have much higher prevalence of these symptoms compared to those in the middle of the income distribution and on the bottom. One other topic we've been paying a lot of attention is the mental health of young people. There's a lot of debate on whether this is really declining and getting worse. It's a complex phenomenon. There's increasing awareness, less stigma, better detection. There's also a change in language, but I think we are more and more confident to say that indeed there's also a decline in the actual mental health. What you see here is a rather general indicator that is about multiple health complaints. It's one of the few that is available across country in a bigger number of countries, but translates mental well-being. And you can see that systematically the rates of multiple health complaints worth well-being were higher in 2022 than in 2018 and 2014. I wanted to bring you also some numbers on dementia, not without referring to the caveat. These numbers are estimates from IHME. So the result of putting together several data sources, but also quite some extrapolations and assumptions. They are still important to give us an idea of the magnitude of the problem. And again, the message is that prevalence is on the rise. You can see the bars were referring to data numbers estimated for 2011, and then they would have increased to 2021. And the projections are also for an increase in 2040. Beyond the trends itself, it's important to look at, for example, the care the care people receive. This slide here on dementia, if I can go back, sorry, it's a bit slow in terms of the control of the slides. Okay, now it was too much. Hopefully now it works well. Yes. So it's a slide just showing antipsychotic prescription overall in older than 65, which is an indicator. I mean, of course, these are medications that can be needed and used, but overall not really appropriate for the management of the average symptoms. And what you can see here is a suggestion that the prevalence of these medications is quite high on average. More than 5% of people over 65 in these 15 countries, which is an indication of not the use of the best appropriate care available. We know also, back to mental ill health and mental health conditions, that they have a large impact on how people function. This is data from Paris, very recent data from this big initiative the OECD conducted to collect information based on primary care, people with chronic conditions, 45 years or older. And what you can see here is that within people that have at least 2 chronic conditions, those that have one of these being a mental health condition have much worse social functioning. So it's the triangles, and you can see that throughout all the countries, these people have the proportion of patients that have an excellent social function is much lower when people have one or more chronic conditions, that is a mental health condition. So really impacts that go beyond, let's say, the other chronic conditions. And besides what is the impact on people's lives, on their functioning, we also know that mental ill health, has dementia as well, has high impacts in terms of the systems of the countries, costs, right, and monetary costs in this case. So this slide shows you the several types of costs that come from mental disorders, and I think one of the big messages that we try to show is that we are discussing much more than just, of course, the costs for the healthcare system, which are indeed actually only about 1/3 of what we estimated to be the cost of mental disorders. Then there's also other direct costs like social benefits, so all the support paid by the welfare system. But actually, almost a bit more than 1/3 is what we would call indirect costs attributed to the labor market: participation, absenteeism, and well, even presenteeism, which is very hard to measure, so not probably contemplated here, then they would mean even higher costs. So indeed, I think I would say brain health conditions, in this case with specifically mental disorders, very costly to our societies in all the fronts. So given all these challenges, the OECD was challenged by the Ministries of Health already in 2017 to think through a way, let's say, to have a mental health system that would address the increasing burden and complexity of situations linked to mental ill health. What we've done, we've put together a group of experts of all the sides, all the domains of society, including people with lived experience, to develop the OECD Mental Health Performance Framework. Then I will show in a bit what it looks like. And then, of course, as you know, we are known as an institution for working strongly based on data. So we try to operationalize that to actually measure the performance of mental health systems in OECD countries, and then identify which countries were having good practices, promising policies to kind of support the transfer between countries. This work is already published in 2021. But still, it's very core. It's at the very core of our work in any case. So the framework we developed has 6 pillars. For the sake of time, I'll not go through all of them, but there's 2 of them that I want to highlight in particular in a bit to you. And then here you can see the second step in which we transformed, or we operationalized that framework of 6 pillars that go again from person-centered care to quality of care and so on. We operationalized it in 23 indicators. I think the biggest message is that you still see a lot of white, let's say, cells. So data in this domain, it's still lacking for us to properly conclude about the performance of countries in terms of their mental health systems. And when there's data, the message was very mixed. So there was not 1 or 2 countries that we could say they're really high performing in their mental health system. And I guess just to close, the 2 domains of this framework that I wanted to call your attention to. One of them is that we say that a high-performing mental health system, and please note that I'm not saying mental health care system, I'm saying mental health system because we believe it's broader than just healthcare, that it should take an integrated and multisectoral approach to mental health. This is work the OECD have been doing since 2010, 12 already, for more than 10 years. We've been looking at how to implement mental health policy in other domains, namely workplaces and the employment domain, welfare services, the education. So we believe that the right way to do is pursuing a mental health in our policies approach, ensuring that the physical needs of people with mental health conditions are met, that we will involve the social protection systems and encourage a return to work and education, and enable the frontline actors that work in all these domains, in schools, in workplaces, in social services, to be properly trained and connect with individuals with these needs. And the other pillar that I think is quite important to discuss, it's of course the prevention of mental ill health and promotion of mental well-being, or good mental health, if you want so. So we've been also developing a lot of work in that front, with a couple of specific objectives that we believe systems should have: reduce the rate of suicide, ensure mental health literacy, make schools mental health friendly environments that build resilience, and ensure that workplaces foster good mental health. And again, the role of frontline actors that go beyond just healthcare workers, teachers, all the educators, people, managers in workplaces, that should also support people in being able to seek help. So to stay within the 10 minutes, maybe I conclude here. I invite anyone that has questions about either the first set of data I showed, or also about our framework, to make them later in our discussion. And I maybe finish just with a couple of examples from our past work in the bottom, and a couple of the titles of work we will be publishing still this year, including again some work on best practice on mental health promotion and prevention, estimates on the burden of mental ill health, work on dementia, and work on children and youth mental health. You have my email, you have our LinkedIn website, so ways of staying connected if you want to know more about this work. And that's it from my side, Frederick.
Thank you very much, Francisca, for this thorough, let's say, overview of all these dimensions. Obviously, the link that you just provided will be shared with everyone, so that everyone can have access to those resources. But I think that very importantly, we will ask to our audience to keep questions for the discussion part. But if you'd like to log on the chat the questions that you may have, or the comments to Francisca, please do so we can capture that already. And it would enable us now to move forward with our program with our next speaker, who is Johanna Lai from UNICEF, so the UN Children's Fund. And Johanna, you are there, the adolescent health specialist, and we look forward to your contribution. So the floor is yours.
Thank you so much, Frederick, and to everyone. It's a pleasure to join. I hope you guys can hear me okay. And today I just wanted to touch a little bit on some of the challenges and opportunities we see from UNICEF at a global perspective, and why it is that we are prioritizing early and also sustained investment in brain and mental health. So on the next slide, I don't know if I can control them or if...
Yeah, you should be given the control of the slide, but if there is an issue, we can do it for you. So
does that work? Sorry, I didn't test this with you earlier. Okay, perfect. So really, as an agency that's focused on child rights and children in particular, as our age mandate, supporting brain health from the earliest years is not only something foundational to individual well-being. I'm sorry.
No, carry on, Yona.
Okay, well-being, but we see is something that underpins really virtually achievement of all SDGs. So from the prenatal period to infancy and early childhood, these are particularly sensitive phases where the brain is growing rapidly. I think it was already mentioned by Francisca as well, when the foundations for cognitive, emotional, social development are being laid. This continues into middle childhood and also adolescence. Adolescence in particular is a phase where the brain undergoes significant growth, which shapes capacity for decision making, emotional regulation, social connections, and these have a great impact, again, not only on mental health during the teen years, but also into adulthood. And one of the areas we see that is somewhat overlooked part of investment is caregiver mental health. And caregiver, we know, who is experiencing mental distress without individual or family level support, this is difficult for them to provide the consistent and nurturing care that a child needs. And so part of promoting early brain health and mental health also means supporting parents and caregivers. That's something very important for us as well. And so, yes, hopefully, I know this slide has a lot of words on it, but we'll share this. As we've mentioned, we see that there are critical development moments across the life course that offer those important opportunities to boost and address the factors that would help or harm mental health. And in 2021, UNICEF published a State of the World's Children report on mental health, which identified 23 risk factors across the life course. Now, these are not totality of everything, but it's what we were able to draw out based on some years of DHIS data. And so if we look at these factors, they're all modifiable. They range from maternal age, low birth weight, you can see into early childhood, lack of acceptable diet. So nutrition plays a role, not having early access to education, lack of things to play with even. So you can see across, I won't go through all of them, some of the factors here. And we notice, yes, all of the factors are modifiable, and also important to note the distribution of risk factors. We see that more than half of these risk factors do fall into adolescence, which does indicate the importance of this period for interventions. And at the same time, when we think about risk factors, there is also the need to focus as well on the things that protect and strengthen brain health, mental health. And one way that we understand these key spheres of influence with the child at the center is first the world of the child. So that is usually, again, caregivers, mothers, fathers, other caregivers having adequate nutrition, safe, stable, nurturing home environments. These all being very primary influences on mental health from the start of life through to adolescence. And then there's the world that's around the child where safety, security, both in person and online, really begin to matter. Healthy attachment in preschools, having positive connections for older children in schools as well and their communities. These are all other critical influences on a child's mental health. And then third, there's the world at large, which I think we all experience firsthand. The social determinants, poverty, conflict, discrimination, migration, and recently also pandemics, natural disasters, climate change. These are all other significant impacts on the lives and mental health of young people that are difficult to ignore as well. So despite the growing recognition of mental health as a development issue and also something that affects us, I think, in low, middle, and high income countries, the investment is relatively still limited in this area. In particular, in low income countries, just 1% of government health budgets goes to mental health. And again, this leaves massive gaps in care. Francisca had also mentioned this. And we also know that 1 in 4 children globally do live with a parent who has mental disorder, pointing again to the need for provision and support for caregivers as well. And then as I just mentioned, there's the broader structural and environmental risks that young people are increasingly facing today. And so all of these factors are challenges, not just at the family, an individual and family level, but they are really things that shape whole of systems and underpin the investment and the need for focusing on these systemic levels as well. Francisca had showed some data. I will particularly show the data again, focusing around young people. We see that 1 in 7 young people today are living with a diagnosable mental disorder. And I do think that there are many more who experience varying levels of distress, anxiety, depression that need support, maybe if not crossing the clinical threshold. And to give us a sense of scale, 1 in 7 adolescents globally is around 116 million 10 to 19-year-olds who are living with mental health condition. And so this affects not only their health and well-being, but their learning, their relationships, their ability to plan for the future and contribute. So again, this is a critical area for young people that is a need. And again, to support brain and mental health, we think of it as an important life course. We've already talked about that from prenatal stages until adolescence, but also the systems-based approach that we talked about. And I think the life course approach, other than knowing that it impacts every life stage, is understanding that development is cumulative. So what happens in one stage of life impacts each subsequent stage that's following that. So early intervention, again, it has to be sustained, it has to be adapted across these different stages of life. And one of the implications for that, it really means to be working across sectors. So health, education, child protection, social services, they all have an important role to play because these are the systems and the supports which children and adolescents interact with day to day. It's not always just health systems. And at UNICEF, what we focus on is working with governments to integrate mental health and psychosocial support across these routine platforms, whether it's equipping teachers to promote social emotional skills and recognize distress, or training healthcare workers to provide first-line support, or embedding mental health and psychosocial support into social protection programs. Just switching to the next slide. I think it's not, I'm not sure if it's going on your end. It seems, oh, sorry about that. Yes. So I know we are focused a bit on discussing research and research gaps, which I recognize that there are evidence gaps, particularly for low and middle income countries or in the face of changing landscapes today. But we do have more evidence than we have ever before on what works. And I think one of the big tasks we have is also translating this evidence into action, especially in low resource and humanitarian settings. And one of the focuses of our work at UNICEF is about scaling what we know works, adapting proven approaches into localized realities. So being able to also embed accountability into systems so that mental health is not kind of just left to chance. And I think a lot of this I've touched a bit upon before, but it involves building workforce capacity across sectors, promoting also meaningful engagement of young people and their caregivers as well, building integrated monitoring systems so we're able to track outcomes, and also being able to advocate for sustained domestic investment as well in national budgets, health budgets, education budgets. And so I won't go into details for the sake of time, but I just wanted to briefly highlight a few of the MHPSS intervention tools and resources that we do have available, specifically developed to reach children, adolescents, and their caregivers across different stages of development. And these are all, I wanted to note, open access as well on UNICEF site. And most of them developed together also with WHO. So during early years, in particular, we have a Caring for the Caregiver package, which aims to enhance caregiver support. That also includes a supplement specifically for caregivers who are adolescents themselves, so parents who might be adolescents themselves. Through middle childhood, we have Play, Heal, Team Up, Bloom, which is in field testing. And these are just some tools to provide approaches that would help children develop emotional regulation, build resilience, help them to navigate through distress in age-appropriate ways. These interventions do also include a focus on creation of safe space and social connection and support, in particular for high stress and humanitarian contexts. And for adolescents, we have the Helping Adolescents Thrive tools, which are largely focused on promotion and prevention, while we also have something called Early Adolescent Skills for Emotions. It's a psychological intervention that was developed for younger adolescents who are experiencing distress. And also I Support My Friends, which is a peer-to-peer psychological first aid training and supervision package. So I think these are just some of the global guidances we have, including a multi-sectoral operation framework, a minimum services package, and also EQUIP, which maybe some of you are aware of. It's aimed at building foundational helping skills for providers and also gives a competency-based assessment framework. So I'll just stop here because I know time's up, but I wanted to say thank you. And at UNICEF, we're committed to working with partners across the world to ensure that optimal brain health and mental health is there for every child. So we look forward to continuing to learn and partner with all of you. Thank you.
Great, thank you very much, Joanna. And we obviously look forward to the conversation as to how we can maybe expand on many of those issues. But it's now time for us to move on, as we have a colleague of yours from another UN organization, from UNESCO. So the UN Organization for Education, Science and Culture, Daphna Feinholz, who is acting director of the Division of Research, Ethics and Inclusion. So Daphna, you're going to talk to us about the recommendations on the ethics of neurotech. So it's probably going to be a little bit more specific, but we are equally looking forward as to how we can integrate that into our conversation later on. So over to you, Daphna.
Thank you. Thank you very much. Thank you very much for the invitation and for the opportunity to share this, the work that we do on neurotechnology indeed. And just let me tell you first that we are also, the IBC, the International Bioethics Committee, is currently working on a report on mental health for children and adolescents in the digital world. But it's very interesting because the idea is that they are also taking into account many of the things that our colleagues from OECD and UNICEF indeed have also identified as very crucial for the mental health of this population. So it's not only the digital world. So I will give you an overview of the recommendation, but at the same time I will also try to focus specifically on how we are dealing with mental health and brain health in this document. So am I supposed to be able to see? Yeah. I think I'm not having the control yet. Okay, thank you. Okay, so can I go to the first one, please? Now I see the problems that, okay. So, just for some context, although many figures have already provided by OECD and UNICEF, but just to give a bit more of information about mental illness and depression in particular, as one of these kind of illnesses that are suffered by 1 in 8 people around the world. And one of the things, the good things about the neurotechnologies is that they can help us to predict symptoms when at the onset and the response for treatment. There is somebody with a microphone on. So indeed, neurotechnology holds great promises for addressing major diseases and conditions, such as disabilities related to nervous system dysfunction, such as disorders such as Parkinson, Alzheimer, that was already also mentioned before. Indeed, they are growing because the population is also aging. So all these kind of neurodegenerative diseases are also growing. And Alzheimer is the 8th leading cause of death around the world, as you can see with this in this study of 2021. And there are many opportunities with brain-computer interfaces for other kind of diseases like paralysis, etc., but also to other mental health conditions such as attention deficit and concentration or epilepsy, because these interfaces can also help with the diagnosis, the prognosis, and the treatment. Okay, so I'm not going to go into these details of how we developed the recommendation because I want to focus more on the content. But just to tell you that it's a 2-year process since we got the mandate until the adoption that we expect of this recommendation in during the general conference in October, November. So it has 2 phases. One phase is non-governmental and the other one is governmental. In the non-governmental, there were experts from around the world, and there is a very wide consultation that took place. More, as you can see, with more than we did the consultations, and this is non-governmental representatives, neither the experts that did the first draft, neither the ones who were consulted, but it's the users, the civil society, the academia, the practitioners, etc. And we did an online consultation with more than 7K comments, and the national, regional, and sub-regional consultations with more than 110 countries. And then then all these comments were introduced in the document, and then it was sent to the member states for their comments, and then we had the negotiation of this text in May. And then that is the text that we expected to be adopted. So it's based on the first draft, all the consultations around the world, and then the comments from the member states and the final negotiation. I want to say here that this document was prepared in all these phases. We have been working very closely with the OECD. They were also participated in the consultations, super close with UNICEF, with a High Commissioner of Human Rights, and with WHO in terms of language, in terms of issues that need to be treated. So the main point of the recommendations, first of all, is from the ethical approach. This is, I think, what is most important. We are not focusing so much in the technologies. I mean, we are definitely having a big description of technologies, but the most important thing is that we focus on what is the features of the neurotechnology that are central for any ethical relevance. So even if the technologies advance and change, because that's the nature of this ecosystem that advances very quickly, it will remain valid and regardless of these technological changes. So, and the framework can stay agile, dynamic, and adapt to these new advancements that are being produced. Now, it also approaches neurotechnology. So it was the same. We did the same for example, for ethics of AI. So when the large language models came, we didn't have to change it because all the ethical challenges were already contemplated, and that's why there was no need to prepare a new document. Now, how does ethics is understood? As a systematic, because it's not like because as you know, ethics is part of philosophy, so there is a systematic normative reflection based on a holistic, multicultural, multidisciplinary, pluralistic, and evolving framework. Meaning that we have to have a very comprehensive framework, that it has to be a normative process, and a systematic process or a normative reflection mode that will include the different cultural perspectives, the different disciplines, the different ethics and moral approaches, and an evolving framework, and having that an interdependent, human-based, of course, it's human rights-based, but also values, principles, and concrete actions that the idea is that all together will guide societies in dealing in a responsible manner with the impacts of neurotechnology, not only in human beings, but societies as a whole, and also the environment and ecosystems. And I will explain you later why. Okay, so what is more important in the recommendation? Includes in the scope data, structure, activity, and function of the nervous system, and that is referred to as neurodata. Even if collected outside the medical context, it covers health and other areas of applications beyond health. And I think that is one of the most important achievements of the or one important features of the recommendation, because within the medical context, we have a lot of promises, and we have a lot of more regulations, despite of the intersection with AI that brings a lot of new challenges also for ethics committees reviewing research, or the ones who are approving, for example, the technology. But in any case, there is some framework in place, but with outside the health, there are not. And this is where we have a lot of challenges, and particularly also for children and adolescents, and then in general for mental health. It defines neurotechnology as devices, systems, and procedures that directly measure, access, monitor, analyze, predict, or modulate the nervous system to understand, to influence, to restore, or to anticipate the structure, activity, and function. So as you can see, it's quite comprehensive. Considers neural data as well as indirect neural data and non-neural data, allowing mental states inferences as sensitive and personal data. So there is this data that is collected directly from the traditional neurotechnological technologies, but there is also other information that, if aggregated in such a way, can also allow us to make inferences about the mental states, and hence have also the possibility to influence them. And that is why both kind of data are considered personal and sensitive, because also they are definitely giving information about an individual. It considers neurotechnology in the whole life cycle and the diversity of actors who are involved in every stage. So it really all life cycle, from the stages of conception and how we do the research and how we deploy it, etc., up to the disposal and recycling. And here is where the impact on the environment also comes into play. And it also includes as I already mentioned, convergence with other technologies, in particular with AI. And I believe that the fact that it is both all the life cycle, that it is neural and non-neural data, and also that the fact that it's medical and beyond medical is what is a very comprehensive document. Okay, I don't know if you see it completely in my, but I suppose yes. So you can see there the values and principles. I'm not going to go into all of them, but just for you to see the respect and promotion of human rights, the human wealth and well-being, ensuring respect of diversity, fairness, cross-cultural perspective, global solidarity, sustainability, integrity, and responsibility. And we also have, of course, as the traditional ones, beneficence, proportionality, do not harm, autonomy, freedom of thought as one of very important, protection of neural data, as well as the indirect neural data and non-neural data, allowing mental state inferences, non-discrimination, accountability, trustworthiness, transparency, epistemic justice, public engagement, best interest of the child, and protection of future generations, global and social justice, enjoying benefits of scientific benefits. And as I said, we have values, we have principles, but then we have concrete areas of application, because it's about the what, but it's also about the how. So we have all these areas of application of policy actions, one that covers what the government should be investing on, use, and how to regulate this technology for the different actors, both the governments, but also the non-state actors, everything that is related to data policy, security, communication, gender, health. And there are specific domains of application outside health, in which you can see education, labor, consumer and commercial domains, and consideration for special users, which many of them have or are already included in the rest, but we specifically focus on people with mental health conditions. And also there is one specific users, which is children and adolescents. And of course, enhancement and implementation. And very quickly, I have only two more to show you how in concrete we deal with mental health. So at the core of the recommendation, we have the recommendation is ensuring transparency and accountability, particularly in public funding initiatives related to mental health, brain and brain health. It's already, the concept is included in this document. Or establish oversight mechanism to evaluate the physical and mental health impacts of the use of these technologies. I mean, I'm not just reading few to give you a quick idea. Assessments of neurotechnologies impact on student development, including mental and brain health. And also in the neurotechnology in the workplace, we are also particularly focusing that mental and brain health need to be preserved, and the use of these technologies should be focusing more on this and not on productivity. And then let me go to the last one because I might be being too late. And then there is, as I told you, a specific action for specific users, which is this one. And this is on persons with health and mental health conditions. So we added other things that could be specific for this population that were not included in the rest of the text. So there is research and promote awareness raising to address the increasing prevalence and special needs for these people, considering allocating long-term advocacy and funding for students, for studies, for post-market oversight, for example. Feedback and engagement with persons with disability health, with persons with mental health conditions and their advocates. And then support also the development and deployment of these technologies that is affordable and designed to improve quality of life. I'm not going to read you everything because I will give you here the link so you can also see the text and also the two documents that we have produced. One is by the IBC, International Bioethics Committee, which was the reason also why the General Conference gave us the mandate to develop this recommendation, which is the ethical issues of neurotechnology. And we also conducted a study of the investments and publications, how we're developing in the different parts of the world. Thank you very much.
Thank you, Daphna. That was really, really clear and complete. And I'm really sure that we are going to come back to some of those key points later on. But as time is running, I'd like to invite our next speaker to the floor, Guglielmo Schinina from the International Organization for Migration. And Guglielmo, you are the head of the Mental Health, Psychological Response and Intercultural Communication section in IOM, and would like to hear from you what brain health and migration actually have to do, but also how particularly in the context of IOM's work, this has become increasingly relevant. So over to you, Guglielmo.
Thank you so much. Thank you so much for the invitation as well, because it's not for granted, that a migration agency is invited to speak in such a context. But we are actually very, very grateful to be here and also to contribute to this discussion. We can move to the next slide because I'm not sure. I'm able to do it. So just to explain what is the IOM role in the mental health, psychosocial support, and intercultural communication domain. So the domain which my unit is tasked with. So first of all, this unit exists from 1999. So we are one of the first international organizations, apart from WHO, actually to equip itself, with a dedicated mental health and psychosocial support unit. This was quite important for us because we, obviously, assisting migrants started to see that the psychosocial dimension and the mental health dimension of their well-being and integration were determinant, in determining positive outcomes. Just to give you a bit the scope of our program, in 2024, we reached 1.8 million beneficiaries in 85 countries. This across IOM programming, so in emergencies, in post-emergency, in transition and recovery situations, but also and especially, if you allow me, in assistance and protection of vulnerable migrants and immigrant integration. According to recent evaluation, independent evaluation, IAM is probably one of the international organizations with the largest footprint in provision of mental health and psychosocial support services. In the same year, last year, we trained 36,000 professionals. When I talk about professionals, I don't talk about only health professionals, not mainly health professionals, but across the board, so humanitarian, migration, law enforcement, social services, education, health professional, in issues related, the various issues related with the mental health, psychosocial support, and population mobility. Our approach, just to finish this small introduction, is holistic in the sense that we don't look only at obviously mental disorder, but all the contributors to good mental health. Is multidisciplinary in the sense that our teams are comprised by psychiatrists, psychologists, but also anthropologists, artists, educators, social workers, and so on. Is systemic because obviously when you work on migration, even before starting, helping the individual, you have to understand if the migration system itself or the migration policy itself is in fact the determinant of the bad mental health of the migrants, involved. We are focusing very much on a community-based model of care. You probably have heard, of the IAM manual on community-based mental health and psychosocial support in emergency and displacement. If not, you can look at it, on our website. It's free and translated in in a lot of languages, so you can download it. And then we, as I said, integrate as much as possible mental health concept in all the organization's activities, not only, acting as a dedicated sector of intervention. Our focus is really, because we deal with migrants, on strengthening social relational supports and educating referral systems in cultural diversity in care, which I'll go back to in a second. Now, who is a migrant? Because I think, this is quite important, to define, before we start talking about the situations. According to us, a migrant is an umbrella term not defined under international law that reflect the common understanding of a person that has moved away from his or her place of usual residence, whether within a country or across an international border, temporarily or permanently, and for a variety of reasons, so regardless of why they are moving. So you understand that these terms include some well-defined legal categories and some that are not really defined in international law, like international students. So to be more clear, these include the exchange student, international civil servant, migrant workers, academics, but then that are not particularly vulnerable or more vulnerable than other population, and then victims of trafficking, accompanied separated children, irregular migrant, refugees, asylum seekers, that usually bring with themselves a wider spectrum of vulnerabilities to mental health or mental health conditions. Now, the question that we always ask, are migrants more at risk of developing mental disorders? Well, you saw how many populations are involved, and these are populations that come from different countries and end up in different countries, transiting for other countries. So the research involves too many different populations to have general comparison or generalization. You are researchers, so you know this better than me. So we have always to break down per migration category. Research is not very technically sound in the migration sphere because epidemiology, so the epidemiology that comes from hospital data, does not grasp legal status usually, so they don't say, this person was a migrant or not, when you get, national statistics. And this is a good thing, in fact, because it avoids discrimination and stigma. The studies are rarely longitudinal. So whenever then study happens, the study in a certain given moment with a certain specific situation in a certain space, so that's not the best way. Studies are often based on self-reports, so you distribute checklists in migrant center like this, people just tick, it's not a clinical interview, especially, it's not, I don't know, a brain scan or things of the sort. The sampling is not accurate because of the reason that we were saying before, having equations, that really, bring to a meaningful sample with this variety of populations is very, very difficult. There is, as a result of this, there is a variance between the same conditions, results across population that is enormous, so then, you understand there is something wrong also with the construct of the research that is being conducted, and mainly cultural differences are very rarely accounted for in everything that we research. In general, it's not possible to generalize. It's always a unique combination of where people come from, what happened to them in the past, in which environment they are, and what are the integration assistance that are offered in this environment. Banally, in a very banal way, do they have access to healthcare or not? And do they have access to mental health care that usually in most of our countries is positioned at the secondary and tertiary level care, not the primary, that is usually allowed to migrants regardless of status or not. Social support is an extremely important determinant of good mental health, and obviously access to care. Sorry, just to go back. There are, however, certain categories that in research, as I said, if you break down in categories, are permanently a bit more at risk than the other. Why I say a bit, a bit is not a very scientific term, but because you don't have to expect epidemics, of mental disorder or neurological disorder among this population in respect to other population. But there are some consistent, small in dimension, but statistically significant variations, and these are refugees, victims of human trafficking, accompanied and separated children, and are migrants that are put in administrative detention. Obviously, this is, let's say, directly proportional to the time spent in detention, and also directly proportional to indirectly proportional to the distance from the moment of release. What are then the most prevalent disorders that we identify, in our studies? Anxiety, depression, PTSD, that's mainly on victims of trafficking and some refugee, and psychotic disorders. So the same disorder of all other populations, basically, so in the same line. Why I'm stressing on this? Because usually there is an understanding that PTSD is much more prevalent than other disorders in migrants and refugees. That's not true. It's still the third or even fourth most prevalent disorder. Just what is more interesting, is the fact that it's higher among migrants and refugees than other population, but is still not the highest, prevalent disorder. What about neurological conditions then, that are more related to the discourse that we are conducting today? They are rarely accounted for. So you saw it before, is depression, anxiety, PTSD, and whatever. There is nothing neurological. Why? Because usually, in the division of labor, in the migration environment, these are considered more related to the specialized health and disability realm rather than the proper mental health domain. So it's quite strange, especially in emergencies. If you look at it, these are not really part of our statistics. They go into the specialized care statistics, specialized healthcare statistics. However, we have some data that come from that, the most prevalent conditions in our, so usually, just to tell you something, I just received data because of this meeting from Bangladesh, from Ethiopia, and from Nigeria. Usually 1/3 of the people that we refer, among these 1.8 million that we refer for severe mental disorders, or we refer to specialized mental health care, around 1/3 are referred for neurological conditions. And these are mainly seizures and epilepsy, cerebral palsy, developmental delays, hydrocephalus and congenital neural tube defects, stroke, traumatic brain injury. The prevalence and incidence is very similar to those in the countries of origin of the migrants, and dependent on factors like age of population, childbirth practices in that specific country, malnutrition. So basically, you will have more seizures in certain population, more congenital neural tube defects, in other population because of these, or where they come from, basically, what are the practices in that country. So this is quite interesting in terms of public health, because you can actually look, predict somehow, what is going to happen in a certain population. What about neurological condition? Dementia in refugees and migrants, as you probably know, the World Health Organization has just 2 weeks ago, I think it was, or 3 weeks ago, issued their new research piece and guidance on what to do for dementia in these populations, that I think is worth reading. I'm not going obviously to give you a lecture on that, in these few minutes, but it's worth to look at, in this sense. It's a very, very recent publication. So to conclude, migrants are equally affected by neurological conditions than resident populations in their country of origin, more or less, So, but as I said, the research, we can trust it only to a certain extent. These, however, might be different in the countries of destination because they might bring certain neurological conditions that are less present in the country of destination. This is, however, predictable when you know which populations are in your territory. As I say, it is specific not only because it's population, but it's also age specific. Some categories of migrants can be more at risk than others. So we have to look at refugee, by instance, from war and natural disaster, have more traumatic brain injury consequences than other population. That's something that we have to know and look for, which is usually not done. MHPS data collection and research in emergency is weak on neurological condition, on the top of the other weaknesses that research has in general, because it tends to focus on psychological conditions, and brain conditions are typically considered an issue of specialized healthcare or disability. This is something probably that together we should look at, to have a better understanding or a better cross, country, cross-sectorial collection of data. In the migration environment, neurological conditions risk to remain undetected and untreated because usually their care is at the secondary and tertiary level, while many migrants have only access to primary and emergency healthcare, if any, by instance, undocumented migrants. So these become sort of behavioral problems, so only the consequences read at the expense of the community of migrants that are looking into them. This is also further compounded by stigma in relation to certain conditions. So we have still to understand that while we are talking about brain health, for most of the population we work with, the 1.8 million that I was saying before, mental health, and especially of neurological origin, so that affects largely behavior, is considered to be an issue of possession, not really of health. So this obviously brings to a series of further complications. Just to conclude, we should give more emphasis to grant all migrants access to anamnesis and treatment for neurological and brain-related condition, that is to have it more present in environments where migrants are, so education, social services, but also primary health care, somehow, because that's, what they have access to. Research on brain health for migrants may be hampered by cultural, social, legal, and other barriers, that we have to consider, in this sense. Very, very simply, if I'm an irregular migrant, I don't want to be part of a study, especially a study that studies my brain, because I need to register. If I register, I'm in fear of deportation or detention. On the other side, I might have issues that are cultural in nature against, the fact of people, trying to do a brain scan, or things of the sort. And any anamnesis and treatment cannot be detached by efforts on inclusion, socialization, community-based support that are important factors in mending neural circuits, as you all know, and functioning, brain and behavioral functioning. Why I'm saying those? Because in the past we have also programs in which a rich state, would do brain research, on a population to understand, by instance, levels of trauma, of impairment due to trauma, and then bring them to another country to be treated. This wasn't successful because obviously social support are, an integral part, of treatment, in this situation, as you all know. And that's why also for migrants, also treatment is more difficult because on the top of all the issues on access, there is also the issue of social support that they might not receive once they are back home, after the treatment. So this is everything from me. I hope it was useful somehow, and thank you very much for the invitation.
Thank you, Guglielmo. No, very, very interesting. But for the sake of time, I'd like to move on to our last speaker, as we are way beyond time by now, and I'd like really to offer similar chances to everyone to be able to present. So our next speaker is Shiva Dostar, who is the head of the European Investment Bank Institute. And Shiva, you're going to present to us something probably a little bit broader in scope, which we are looking forward to, but about a systemic investment into the brain economy. So the floor is yours, Shiva. Over to you.
Thank you very much, Frederick, and thanks for inviting me. Indeed, let's talk about money. I haven't heard the word money that much so far in the prior presentations, and I do think that that looking at the investment needs, even in this particular context, when we're talking about collaboration on a global stage on the research side, is very important, and therefore the role also of the EIB group, which is EIB EIF in that context, is important. And I will hopefully in the next 10 minutes explain you why, you know, bearing already the follow-on investment needs of all the great research that is ongoing and that needs to absolutely be intensified, accelerated, you know, how that is linked to the follow-on investments that then that are happening, you know, by the EIB group. So for those of you, and I hope there are very few of you who have never heard of the EIB. So for those of you, we are the Bank of the European Union. We're in fact the largest multilateral sort of investment or multilateral lender in the world, so even bigger than the World Bank. We have primarily, our remit is 90% really of lending in the European Union, and therefore a lot of big volumes in infrastructure and innovation. We're headquartered in Luxembourg, and basically roughly, as you see in the slide here, you have 90 billion of annual investment. You know, we had it last year, and mobilizing with that being catalytic in the order of 350 or so billion. So it is therefore quite a large force to reckon. And let me now briefly tell you about the EIB Institute, which I'm heading. The Institute is sort of within the EIB group, the philanthropic arm, and as such, we promote academic research, social, cultural activities. And in that also have a very important initiative that is referring to the foresight. Here we're really looking to future-proof EIB's and EIF's investment agenda by looking at specific topics together with experts, policymakers, other investors, and really gain a better understanding, bring that external knowledge into the EIB group. And I think in that context, I mean, the context of brain economy, you will see this is actually one of our, you know, the foresight is for me one of the important areas where we hopefully will bring more focus on the EIB group into the brain health and brain economy. I would also like to briefly highlight another activity that we have now intensified is, as the philanthropic arm, be also the entity that sort of is engaged and setting up now a systemic also collaboration with European foundations to mobilize also philanthropic capital across all our investments. Here in the past, we have had excellent collaboration. We continue to have excellent collaboration with the Gates Foundation on health, but clearly there is more that can happen. And certainly on the European side, more philanthropic capital and more of a European mindset within the European foundations, which I believe can also hopefully bring some additional funding to the broader research community in Europe. So maybe just briefly also highlighting therefore the foresight on brain economy, where Frederick has been a part of it, and I also, I believe, saw Pavel Svoboda on the list of participants. So these have been our valuable partners in this, together with many others. And we did have a roundtable back in February of this year, as you see on this photo, bringing together roughly 50 experts, policymakers, public, private investors, advocacy groups across the whole brain, you know, I would say economy spectrum, so brain health, but also, you know, looking at it from many different angles, precisely to sort of take a much greater cross-sectoral approach and a sort of transversal approach. The purpose was also to really raise awareness with the EIB's top management, and we had 2 of our vice presidents responsible for health and the EIB Institute present. So this was it was really an I would say watershed moment to bring the brain economy closer to the bank's investment agenda. I should say here that in the last 5 years, we have invested already roughly 22 billion in investments across both health and life sciences, infrastructure, innovation, R&D, medtech, biotech, large pharma. So it's not that this is that health as such is a new area, but to bring a more focused and a more, I guess, better understanding of the actual brain health investment needs is precisely the purpose of such roundtables. And we continue to build on those, and therefore I'm also very fortunate. I'm very honored to be participating in such events like today, just to ensure that we are part of the conversation going forward, also in other circles. So just very briefly, again, coming to the EIB Group strategic priorities. Again, I don't want to bore you too much with the EIB Group, but it is important to raise it, but because you may, if you ever see them, wonder why isn't there one on health? Well, on health is actually a very sort of core transversal priority, clearly, and it touches on all these others. Social infrastructures, where the hospitals, the elderly people, care facilities, and so on would be coming in. Innovation will clearly come in on the technological front, but clearly health, we see it in so many different ways, associated with these priorities, and therefore will continue to get investments in the range of 4 or 5 billion a year, and hopefully increasingly, as we get more deals and opportunities, we will have more investments flowing into actually brain-related projects. So this is just to give you a sense of the magnitude. So the 350 billion is the total investment that the EIB has supported across all its activities, for instance, in 24 with its roughly 89 billion. So there's really this big signaling and catalytic effect when the EIB comes in. Now, just sort of looking at, and this graph, I apologize if it's very crowded and has a lot of circles, a lot of signs. I guess what this actually is saying or aiming to say is effectively EIB and EIF jointly pretty much can cover every investment need from a very, very early stage to large governments and large corporates. And along the life cycle, there are, as we've like to dramatize things, there are valleys of death. And sometimes hopefully you pass the first valley of death, and then you may hit the next one. And what this also shows is therefore the need for public sector investments to mobilize, to de-risk in particular, be more patient, and with that mobilize private capital. Now here I would like to briefly also refer to the Draghi report, which I'm sure many of you have read, which obviously highlights Europe's scientific excellence and the very strong position it has, but it also is a wake-up call to all of us to say that there are weaknesses in the innovation cycle, and we're not very good in Europe at commercializing and bringing that, as we call it very often, bringing things from the lab to the market, to the fabrics, and we are. In particular, also, when we have maybe startups, we're also not able to necessarily nurture them and allow them to scale up and stay in Europe and have a strong footprint in Europe. There are a lot of reasons for that. I guess what I would like to highlight here is that we have nevertheless very, effective financial instruments that can allow both the, support the startups and also the scale-ups, but they require, of course, an enabling environment. And foremost in this particular conversation, there is a continued really need to put more funding into research to create the pipeline and ensure that Europe remains a leader on the research side. And I believe, we all know that there is perhaps in the crisis that we live in, there's also an opportunity, given that perhaps some other global leaders may withdraw from some of the research, and therefore, Europe can actually have its moment and its moonshot moment to really capitalize on that. And this graph in particular is saying, well, if you can bring in a bit of that investor mindset and into already that research agenda, so that that connection to the follow-on investments as the research is commercialized is made quicker, and we can benefit from all of this, the better. And here we very often refer to sort of bringing science into finance, finance into science, and science into finance. What we mean here is, let's see how we can bring in more of that investor mindset into the scientific community, but also we investors need to build on the scientific knowledge so that we understand not only the science for itself, but how it can actually be commercialized and make effectively money, so that whatever the investments are, they are getting repaid. Otherwise, there's always this very high risk perception if you don't really fully understand the science behind it. And I think the research community plays a very important role in explaining this particular point. So again, this I will not bore you with. You will see a lot of colors, a lot of names. All it is saying in this graph is we do have the financial instruments. We even have advisory services, technical assistance. So it will certainly not be failing on that front in order to bring the financing on board. But we need that better connection to the earlier stage and along the innovation cycle, ensuring that the financing flows where it is most needed. And here are just a few examples of some of the sort of many companies that we have invested in, including in neurology in Europe. And these are just a few of them. But I would say that there is probably much more out there. And therefore, if you come across companies that, regardless of which stage they are, and they should certainly reach out to the EIB or the EIF's funds, where the EIF has an LP investment to look for financing, because there's definitely a great interest to support those companies. So back to Frederick and everyone, and here are my contact details. Thank you very much.
Thank you very much, Shiva, and that's probably a perfect way to get us on the launch pad for the conversation. So I'll probably invite all speakers to reopen their video so that we can all appear on screen. And actually, we have also Catherine Marker joining us for the conversation. Catherine, you work at the ANR, the Agence Nationale de Recherche in Paris, and you are the international scientific coordinator there. You've been actively engaged into the CSA BrainHealth, and particularly in coordinating the drafting of the strategic research and innovation agenda. So for all these reasons, we have invited you to be our discussant to maybe break the ice in this panel and in the conversation. And I may actually, in giving you the floor, just inform everyone that we are very likely to run a little bit beyond the set time, because we are starting this panel a little bit late. But I hope it's okay for everyone to stay a few more minutes beyond 12:45. But Catherine, over to you with the first reflections and maybe some of the key points that you heard in the various presentations. And with that, we can maybe then open the conversation. Over to you.
Thank you, Frederick. Yeah, I'll try to be brief so we have time for questions. So first, I wanted to thank all of you for sharing the projects you are pursuing in the brain health space. That was super interesting. Joanna, special thanks for joining. I think you're on New York time, so really appreciate it. So yes, so as you know, and as Frederick mentioned, we have been working a lot with our colleagues at INSERM, but also with all the members of the CSA on the CSA BrainHealth. And there are 4 main priorities and 7 transversal priorities. And the first one is actually around prevention. Sorry, have an issue on my side. Okay. So our first priority is promoting brain health and preventing brain disorders. And we have a specific objective that is around preventing brain disorders with a lifespan perspective. So I think that really resonates with what you showed, Francesca, and also Joanna, with this idea, the importance of prevention. And you also both emphasize the importance of a multi-sectoral approach, which is something we also think is the best way to approach a complex problem, right? We need every stakeholder at the table. And Joanna, I think, it's some conversations we had also at the Foresight Symposium last May, where we know that in the brain health trajectory of individuals, there are some key turning points. And childhood and adolescence are really, one of the most important moments in someone's life for that. So that was something that really resonated with what we're trying to do at the partnership. I want to say a few words also about DAFNA. So another of our 4 priorities is integrating the social, ethical, and legal dimension to advance research and innovation for brain health. And we have an additional transverse priority that is to promote the systematic integration of ethical consideration in brain health research. So I don't think I need to say much more because we're really in that space. And I think there were questions from Philippe around, how do we implement that once we've agreed on some recommendations, because that's a key problem. So I'll leave you the floor to answer this just after that. And then I want to say a few words also about Guillermo, right? Because one of our specific objectives in that priority around ethics and the social and legal dimension is also to promote equity in brain health. And I think, what you showed us today was really a striking example of how equity and also accessibility to care can be a real issue. And, for vulnerable population in particular, it's something that needs to be addressed. And last but not least, Shiva, one of our transverse priorities is to improve translation to the market of brain health innovation, right? So I think we're really in the heat of that. And, one of the things we want to do is try to optimize the continuum of fundamental and clinical research outcomes. How can we bring them to market? How can we bridge academia and industry? So I think, what you presented today, I mean, at least to me, but it really gave food for thought about how we can articulate our activities, right, between, something that's more public and that's something that's a bit more public, but yet, private also, how we can articulate those. So that was really interesting to me. And that's it for my part. So as you can see, like all of the things you said really resonated with the SRIA. So I'm looking forward to, some more conversations. I think it's a starting point, but maybe we can think about, how we can push that forward, maybe produce some joint statements, think about what we can do together. But thank you again. That was really great.
Thank you, Catherine, and great overview. I don't know if I can invite anyone who'd like to react to this. Some of these key points who'd like to.
I can go if you want first. Just in case I have to leave, I want to answer my question. And thank you for that. I'm really happy that we are aligned in the priorities. And since I only focused on mental health, I have to say that for us also the issue of equity and access is one of the basic ethical elements as well. So it's part of what it is it's foreseen, as well as children and adolescents, as it was said. So I think it's much more encompassing than what I showed to you. And then back to the question is like we have already experienced, and we are going to build on the one that we started already with previous documents, because as you know, we have many declarations at UNESCO, either on genome and human rights, so genomic data, bioethics and human rights, did the Declaration on Ethical Principles of Climate Change. And then the last one was also the recommendation of ethics of AI. And we are also building on all the experience that we have with all the instruments, how to implement them. None of them are legally binding. And nonetheless, they have been the ones that have allowed us to create all the frameworks at the national level and even regional levels to make sure that these documents are implemented. So they are then translated, for example, in national legislations or in regional efforts to create frameworks. And we have different levels of implementation, either at the legal, but also establishing, for example, education, capacity building for the different actors. But for example, we want to replicate the model of the ethics of artificial intelligence, and we have two tools. One is the readiness assessment methodology, and the other one is the ethical impact assessment. And the idea is that we go and we work both, for example, with countries, and we make kind of a diagnosis of where do they stand in the development and in the whole life cycle of the technology, but also in all the different dimensions of the recommendation, for example, in that case. So it's the social, the legal, the infrastructure, the education, the research, the work, gender, etc. And then based on that, we take of what exists already, and then we develop the gaps, because there are many gaps, because there are many readiness assessments there, but not, for example, in AI, but not all of them are on AI, are digital, and there are none on ethics, for example. So the idea is to take what it is on there, and then with the people on the country, we help them and we work with them. They develop this diagnosis, and based on that, they develop also a roadmap. And then, and based on their priorities, we help them on how to bring the gaps. So they have this, for example, designed national policies already, or change legislations, or establish legislations, and depend on where. No? And then we have networks of experts to help them, either they are networks from all the parts of the world. And also one is particularly focused on gender and AI. So through these experts around the world with different expertise is the way we help them if they need at the time of the implementation. And the idea is that we collect also all this experience, and that's what we want to do with neurotechnology in a global observatory. And then with private sector, we work, for example, we are building now a disclosure methodology and tool for the private sector, and the ethical impact assessment that can also be used for them to measure how they are developing the technology based on the recommendation. And the idea is to try to close to the gap, to close the loop. So the governments could also say, like, okay, if this technology is developed in such a way, I will be able to, I will be more willing to purchase it than if it's not. And then that's a tool. Those are the two tools that I just mentioned are to help the private sector. And there are a bit more other things, but this is some of the examples how we try to implement it. And governments have to report to us every 4 years what they are doing for the implementation of the recommendation. That's a statutory request.
Yeah, thank you, Daphne. Maybe Joanna, I can invite you to react as well. I mean, I've noted particularly on the issue of the life course approach and multi-sectoral approach raised by Catherine, but maybe there are other comments raised by other speakers you'd like to reflect on.
So yes, I did a bit put into the chat. I'm not sure if particularly Philippe and
yeah, so
yes.
we can definitely well, probably consider answered, unless you'd like to come back to some of the points that were raised.
Sorry, I misunderstood the question. Was it to Mahela's question?
No, maybe you want to expand from what you have put in writing, but otherwise there were points raised about like the life course approach and the multi-sectoral dimension that you have raised.
Yes.
That's been pointed by Catherine. So, I mean, I wanted to leave you the opportunity to expand on this, if you like.
Yes. So I think You know, absolutely. I think these are all complex issues on one hand, and yet on another hand, it seems fundamental. You know, a lot of the things that we do know, the entry points that have been raised for supporting children across, you know, these critical life points, early development, adolescence, and we know that, sorry, the entry points, whether that be school, supporting families, or working in primary care. And it kind of is one of the questions, what is it that is kind of our barrier? And I think part of what we see after working with so many countries is that we still have in our approach, in our mentality somehow, that mental health is very more of a specialized approach rather than foundational. And I think that that means we see it kind of as an add-on or a crisis response, as opposed to mental health really being integrated into a core part of those everyday systems: health, education, social support systems, where young people are, where those early signs of support will be seen. And so primary care, again, what does that look like for us to be integrating mental health at primary care level? That might not be having a psychiatrist in every primary care center, but how do we, and I'll put this document also recently published with WHO by WHO that we supported, is looking at how you can integrate mental health as a core part of the pre-service training for first-year medical students and nursing students, for example. And I think those are the things that we tend to struggle to see how we can actually, integrate in primary healthcare. How do we support education systems to be integrating mental health? And as a result, I think of not having this, services remain very limited, very siloed, and are taking time for people to access, particularly in, I think, not only in low and middle income countries, particularly there, but we also see this in high income countries. And also that we also notice a lot, I think, of pilots, very, very well intended, very, well researched pilot type of programs. But these are not moving beyond the initial phase, maybe because of lack of funding, maybe because of lack of government ownership in particular. Not enough coordination across sectors. So I think when we talk about life course, when we talk about multi-sectoral, we say these often, but it's great that we're having this conversation and with this group of different stakeholders that can help us look at, but what is it? What is it that needs to change in terms of the way that we set up or even conceptualize who is the one implementing some of these programs. And when we look at, budget analysis, we're always looking at health budget analysis, but what about other sectors and how they're contributing? Because they really are well placed to be the ones supporting young people. And lastly, I always want to end, because I feel like I always get a big lesson learned whenever we talk to young people themselves. How are we systematically, not just as a one-off and just getting their opinion, but how are we systematically in all of these efforts bringing them in and having mechanisms for young people to be part of not just the co-designing, but the monitoring and the evaluation. They bring so much to these topics that we have a hard time understanding: digital landscape, or, what they're experiencing and how they're perceiving and understanding mental health, the terminologies, it's not just clinical, but how these things are expressed will really help us, I think, shape and overcome some of these challenges that we have. So sorry for the long-winded answer, but with life course, multi-sectoral, those are terms that we have, but what does it actually look like in all of our work? Yeah, is the question.
No, thanks a lot. And I see that Francisca wanted to react on that. So actually, you're anticipating my move, which was to come to you, Francisca. So please go ahead.
Just to make it a bit easier. Hope you still hear me well. Yeah.
Yeah. Perfect.
Good. Now, I just wanted to expand a bit on what Joanna mentioned, because indeed our presentations had some common points, and either we call it multisectoral or cross-sectoral, doesn't really matter. Approach to policy, it's actually one of the biggest challenges when we are discussing policy decision making and government adoption of the strategies. I think as I mentioned in my presentation, we've been working specifically in the field of mental health in the cross-sectoral approach in the OECD since 2010-12. We actually also have a recommendation that all the ministers of health and labor of the OECD countries signed already in 2016, committing to adopt mental health policies in the education and youth space, work, employment sector and welfare sector. I think we know what works. We know which interventions and programs work. The problem, as it was already alluded here, is actually to promote the full-scale adoption of these ones. I think we also know now how to kind of promote some cross-sectoral engagement at, like, say, the initiative or program or priority level. You can have shared budgets or joint budgets. You can have groups that come from, for example, different ministries and that are accountable to higher levels of governance, special offices of the prime ministers or something like that. So on, let's say, a topic basis or a one-off basis, we kind of know these government strategies to actually make the cross-sectoral approach work. The challenge is to make this the ways of working, right? This links then to prevention, which was what I also wanted to touch on. We are actually working now with one member country specifically, but hoping to develop this further on the evaluation of prevention and then decision making and funding of prevention, because there are two main challenges. The fact that health prevention delivers a lot of what we call co-benefits. So the benefits go way beyond just healthcare, and also on the long term and not immediate. And therefore, how do you make ministries, usually the budgets are at the ministry level, to actually fund things that will go beyond their political cycle and that go to the ministry next door. So I think we can definitely still do much more than what we do on a, let's say, like initial scale or program or topic-based initiative with these mechanisms I was referring to, shared budgets or higher level budgets, accountability working groups, etc. But then to promote a broader cross-sectoral approach to the policy topics, we need to rethink a bit the way our governments are working. Maybe to expand a bit more on the prevention side, I think we kind of all noticed that in the presentations we were talking to brain health, but a lot of times we were talking about mental health or specifically some neurological disorders and so. And I really think that the not only the coordination, but the actual partnership will have a very important role on bringing, the topics that have been worked through a bit separately by agencies like ours here today, really to elevate them to the whole brain health discussion. And I think this is important in all domains, but in the prevention one for sure, because well, when we discuss mental health, actually we have to bring sometimes that discussion more to the brain side as well, including for aspects so basic as fighting stigma and so, but also to understand, for example, phenomena we have been discussing here today with youth mental health and the effect of things like exposure to social media or screens or the amount of information. So we need to even root our mental health discussions a bit more into the brain health to understand how we can well, first understand what's ongoing with our population and then adopt the right strategies, prevent from early on, and look at conditions that are in the interface and being discussed, for example, as well, there's discussions on whether they should be within the mental health space or not, ADHD, autism, and all of those, and discussing cognition more broadly. I think that's really important, and I hope the partnership will have a role on fostering these discussions on a more aggregate way.
Super. Thank you, Francisca. I see Shiva, you wanted to react.
Yes, I'll try to keep it short. Maybe 2 points, and one of the points that indeed didn't raise actually during my presentation, which is the EIB Institute is also responsible for all our humanitarian activities and youth engagement. And on the youth engagement, we're just sort of towards at the end of a very major survey on eco-anxiety with youth using Goodwall's technology. So Goodwall, for those of you who don't know it, they explained to me it's like LinkedIn using TikTok. I mean, you know, very sort of kind of a technological platform that they have used, and they have worked actually with some of your organizations from what I remember. So that data, as we get it in from the surveys of millions of youth all over on eco-anxiety, which actually touches on mental health as well, you know, something we can perhaps share with you and see how we can build on that. The other thing is on our humanitarian support. So these are donations. I mean, the EIB is obviously not a first responder per se. We come in as investor in rebuilding countries, Ukraine and so on. However, we do have some humanitarian, you know, I would say these are more symbolic signs of solidarity. And in the last few years, we have focused on mental health. And therefore, I was like thinking, you know, it'd be great actually for my colleagues who work on those initiatives to follow up with Joanna, with Daphne, because we obviously go through UNICEF for a lot of those humanitarian, you know, donations, to kind of maybe build in a bit more of a targeted mental health support, or just, you know, ensure that we have all the right information. So that's the one word. The second point to Catherine. So Catherine, there is a major, and to all of you, there will be a major announcement later this week by the EIB on sort of an, so you have heard it here first, but it's a Tech EU platform. It's a large initiative to really mobilize between now and 2027, 70 billion of investment towards innovation, effectively, to give Europe's, you know, another edge in response to everything we know from Draghi report and everything else that you also mentioned. So I suggest, and I know ANR you know, we have funded also public research at the EIB with large funding organizations. So please do stay in touch with your relevant counterparts. You can, of course, use me as well as intermediary if necessary. But there is a huge opportunity to right now, you know, make sure that also research organizations benefit from that big push.
Shiva, can we maybe hold you on to that, because it's probably going to be directly connected to what the upcoming BrainHealth partnership is going to do, or is it aiming at achieving? I don't know if Catherine, you'd like to react to this, but how do you feel about this great announcement, Catherine?
Well, it's a bit early to say, because I don't know exactly,
it's a bit
you know,
short and rough.
what's going to be funded,
but,
and you know,
there will, please wait for the official announcements later this week. And we can certainly, I think it's important to then go through all the various channels that ANR and others have, you know, but indeed, I'm happy to then help facilitate some of those, because research infrastructures and research funding and so on, again, it goes through different, more public support schemes that we have. And if there are ways we can make sure that Tech EU supports that, we should, because they're very much part of the package.
Right. Yeah, my hope is that it will complement what we do, that maybe because what we see, there's very little money. So I hope you can come in with much more money and just like make something grow. That would be amazing. But I'll have a look at the platform when it is official.
Thank you.
So Shiva, the official announcement is next month?
It should be later this week.
Later this week. Okay, so we wait for that, and we ask all participants to keep their mouth shut, but they can definitely be excited and looking forward about that. No, but thanks for sharing that with us. Yeah. And obviously very much eager to follow up the discussion on how to shape it and integrate it within the partnership activities. Guglielmo, you wanted to react as well.
Just very briefly, no, it was about the equity issue and money, no, because it obviously, it triggered me in the sense that we are now going towards a situations in which a lot of the research funding, even for big universities, you know, is going to be cut, and it's not only one government, you know, because we see, especially in the humanitarian field, you know, that this is basically an avalanche, you know. If you talk about vulnerable population like the ones I deal with, there is also a tendency to defund the services for migrants, more and more, and also to start deporting migrants irrespective of their mental health status, which is, another issue that will create a lot of problems, at destination. And in all this, there is a third, I think, aspect that is also quite important to consider. That is that in general, also in developed countries that have a national health system, what gets defunded is primary health care rather than specialized health care. More and more. We see it in the UK, we see it in Italy, and so on and so forth, because the most profit come from the higher sectors of healthcare. So this is just I agree totally with Joanna that it's not only about health, but this is the environment in which we are going towards. So somehow it's refreshing to understand that there is a continuous interest by government who are not part of this, avalanche of the funding, but also please don't forget equity, in all these situations, because otherwise we will be in a situation where there are very few countries that do research and provide care to only sectors of the population, instead of having a universal, approach to brain health as it should be.
Yeah, thanks a lot, Guglielmo. I think these are important considerations as well. I no longer see any reactions or questions in the chats for the time being. But it's probably the opportunity, as we are slightly beyond time, to invite each of our panelists for a word of conclusion, and I would probably ask for a 20-second takeaway out of the different conversations, and then Catherine, we ask you for also your conclusion as well as Ulrike. So it's let's say gearing us towards a wrapping up of the webinar. So shall I go by the order of presentation and start with you, Francisca? What is your takeaway from the conversation in today's webinar? And hoping that there will be many more, obviously.
Well, it's definitely we need to discuss. I think we agreed on two sides today on the complexity of the problem, and I think discussion particularly on the cross-sectoral action is a really key one for this topic and many others. But also we also heard of some solutions and developments in the area, right, from the ethical side to the funding. So it's really about working together to make these solutions and these new developments to kind of try to address to the most the challenges, and particularly, for example, in terms of the funding, I guess the private and public side, and also then has always to scale what is the innovation and research, and so to bring that into action at the whole government level, it's always a challenge as well. That would be it for me.
Thank you, Francisca. And obviously, the moment I said that, the chat was quiet, there were a few comments being made. And I see, Joanna, Daphna, that you were also including a few other points. So feel free to maybe address that in your concluding remarks. So Joanna, over to you. And I saw your comment about behavioral addictions and risks in prevention and intervention frameworks. So maybe you can say a word about that as well in your conclusion.
Yes, I think, simple as always, what we'll walk away remembering from, and I think everybody has touched on it from my side, I think it is early investment, it is prevention, not that other areas do not matter, but I think for us now, the time really is on looking at when I say early, I mean the first 2 decades of life. And I really think that more thought around the prevention, how that is integrated across different sectors, as we talked about, how we are actually going from policy to implementation, investment, financing at scale, making these really part of the day-to-day that these different, not just psychiatrists, and not just clinical psychologists work on, but how do we support and build out the workforce to manage and support young people in this. All I had mentioned in there, I think, is as we think about the prevention frameworks, again, we don't have to go into the detail here, but what is it that it should include, and almost rethinking how we've kind of separated a lot of issues, gaming is here, all of these things, the roots and the factors driving them are so common. So how can we also have a common framework to address them within prevention rather than, I'll close it. This is more than 20 seconds. One young person said once that they see all these different services and apps and supports like islands in an ocean. And here they feel like they're drowning in the ocean. So I think what we have to do is bring these things together so a young person is not left, sort of really drowning when they look at all these things that are there, but not able to and not knowing how to access them. So I'll end there. Thank you so much for the chance, and I look forward to working with everybody.
No, thanks a lot, Joanna, and we are so appreciative of you taking the time so early in the morning for you. But I see we are probably all the lifeguards for to prevent anyone to drown in all of these issues. Sorry, I'm always prone to make stupid metaphors in this type of meetings. Daphna, I would like to invite you for your conclusion.
Thank you very much. I think I'm converging with colleagues that these problems are very complex, and we all of us are touching on some angle of it, and that we need to really connect the dots or the island. So neither the adolescent, neither the children, neither the disabled people, neither the migrants, neither anyone will be drowning, because I think we are all trying to address the same problem, and since it's very complex, we all need each other. And I think we all agree also on the multi-sectorial and all the multi-stakeholder approach. This is also ours. And you will find it all across the recommendation for all this. That's why I'm speaking more about governance and not only legislation, because everybody has to play a role. It's not only about putting laws in place. That will not help. And one of the elements that are key in our views in UNESCO always is the participation of those people who are directly affected. So in the whole life cycle that I refer to is all the people that are developing, etc., the technology, whatever, but it's also those who are going to be benefited or affected, because that's the only way of doing the real assessment and the real decisions about where we want this technology to move. And that includes children and adolescents. And we also have this very specifically said that in the recommendation that they have to be part. And for example, we speak about assent, even in research, even if they cannot give informed consent, they still need to give assent, for example. So we really are, I think all of us agree on that, and see how we can then make sure that the investments are also on the same way. I mean, for us, as I said, as you saw, we also mentioned something about the funding. We included that, but for us, it's really about making the right decisions about the funding based on all this very big picture on where and how and for what.
Yeah, thank you.
So we're looking forward for continuous collaborations, honestly.
Thank you, Daphna. Shiva, you're next on my screen, so over to you.
Thank you. Yes, indeed. I would just summarize in three points. One is, let's think of the complete innovation life cycle. So even though the focus may be here on research, let's really think of how to get that research as soon as possible to the market for the global really benefit. Second, as I mentioned, also this interaction of bringing more scientific thinking into the financial community and a bit more of an investor mindset, a financial mindset into the scientific community, because that will in itself also unlock funding and financing and investments. And the third, I guess, maybe sorry for making a plug for the EIB group. So do watch out what the EIB, EIF are now doing. They're, as institutions, we're becoming even more relevant in the current global context. And therefore also in the case of the brain economy and brain health, there are ways to further, intensify our investments. So see how we can be part of that conversation and reach out to us.
Awesome. Thank you, Shiva.
Thanks.
Guglielmo, you're next. And then we come to Catherine and Ulrike.
So very, very quickly, for me is, first of all, again, thank you. And we are very eager, to be still part, this discussion, in this, this network, in the future with a very clear, angle, so obviously, this innovation should go to the market, obviously should go to the scientific community, and for us should also go to who is the final beneficiary of it, to better the life of people, including the ones who are the most marginalized, and usually don't have access, to otherwise, to this issue. So in that sense, we are really eager to collaborate with you in the development of what, of your network, in the next future. And thank you again.
Thank you, Guglielmo. Catherine?
Yes. Yeah, I just wanted to say that as much as I enjoyed the presentation, I think I liked our informal discussion even better, because actually now I can hear about your actual experience, what works, what doesn't work. And that's really precious, that's where the actual information maybe is. So both combined were really nice. And I take Francesca's point about the holistic view on brain health. And I think that's going to be one of our main challenges. So with Ulrike and with the partners, we've begun thinking about how we can make this happen. But it's going to be, yeah, well, we're all for a challenge. So stay tuned.
Super. Thank you, Catherine. And Ulrike, over to you for the concluding remarks.
Well, I mean, listening to all your discussions, it becomes really clear that the preparation and the start of the European partnership comes in timely. It's a dynamic environment, and we will try to integrate as much input from today's and other discussions to align this kind of investments as good as possible, and to create interfaces to the programs you mentioned today, and obviously Shiva taking the entire innovation cycle into account. So we are really taking care of that, and just keep on with this kind of discussion. It's a start. So thanks a lot for your contribution, active. Yeah, what Catherine said there, it's the information lies behind what you're saying, behind your presentation. That was really very valuable. And this is just the start of these kind of discussions. Thanks a lot for that.
Thank you very much, Ulrike. And so I think that on this note, and with everyone's conclusion, we can close this webinar. Sorry that we ran a little bit over time, but the excitement of the conversation probably forced ourselves upon this. But it's also promising in terms of, let's say, creating future opportunities for this type of exchange and collaboration, as indeed we recognize the value in those exchanges. So we will be looking into the format of organizing these further opportunities, but you can expect from us like a report on this on today's exchange. And thank you very much again for your participation and active participation from the speakers and from our audience that was online. So thank you very much. Have a great rest of the day from wherever you are connecting from, and take good care of yourselves, and see you soon. Thank you.
Thank you. Bye-bye.
Thank you very much.
Bye-bye.
Bye, everyone.